First off, thank you so much for agreeing to do this little interview. Dr. Lin, can you just real briefly a little bit about who you are and your point of view?
Yeah, so I'm a dentist with a background in biomedical science, but in the last years, my practice has focused on nutrition. And really, my way into that was looking at people's mouths and the diseases we see in society. And we really didn't have answers as to why these diseases were occurring. And so this was bothering me for a long time. It led me down a road of kind of looking outside the conventional dental literature. And so that really took me down a road to looking at nutrition and how food shapes tooth decay, gum disease, even the shape of our jaws. And so why kids don't grow jaws that fit 32 teeth today. And that's a problem we have not even begun to ask the questions about. And so I think it's one of the biggest health epidemics on the planet. And we've not understood it.
So the traditional advice that we've been getting from our dentists, from your point of view, is incorrect?
I think it's limited. I think we've come a long way in the last 20 years in understanding how the mouth as a connection to the body. Now, society, we kind of look at the dentist as a place we go to fix a tooth, a toothache or a broken tooth. But really, those are long-term processes that really our body has been screaming out for nutrients and balance, for instance, in the microbiome, and we've been ignoring it. And so the scientific literature really hasn't explain that until the last 10 to 20 years. And so now we're plugging that in. We're showing that there is a profound link between the mouth, the body, the gut, there's an immune system inside our teeth, the connection between the oral microbiome and gum disease, for instance. So how we understand all of these processes, and they are linked to everything else in the body.
Really excited about the microbiome. I know in the mouth, there's a lot more awareness that the mouth microbiome is closely linked to the risk for rheumatoid arthritis, for example. And so I find that really interesting. And of course, the mouth microbiome appears to be closely linked to the risk for atherosclerosis. Are there any other systemic diseases that scream out to your mind in terms of the mouth microbiome?
Oh, like the thing is, we have to remember is that once you dive into this literature, you see that we are swallowing thousands of bacteria every second. So the gut microbiome and everything that we link to that really, goes hand in hand with the mouth. And so, for instance, oral lichen planus, which is like it's a fluffy white lesion you get on the cheek. That is an autoimmune condition. We've shown that, for instance, gastric parietal cells, when we supplement vitamin B12, you can actually reduce the autoantibodies in the gut and also reduce the lichen planus. So we actually see a lot of a co-occurrence between gum disease and autoimmunity all over the body. And we know that these conditions exist together. Why haven't we seen gum disease as an autoimmune condition in itself? I mean, the immune system is eating away the tissues of the gums and the alveolar bone. And so, it is an automated response. It is an imbalance between the microbiota and the immune system. And we've not seen it this way. So the literature on this is profound, and we've kind of had a bit of a gap, but I think since the Human Microbiome Project, that's been bridged, and we're moving forward on this.
Oh, this is very exciting. Of course, this really resonates with the stuff I've been talking about, how critical the microbiome is, and how our food determines our microbiome. So are you beginning to think nutrition, and that's not just sugar, but nutrition as a whole, is how we should be addressing gum disease and dental health?
Absolutely. And, the thing about gum disease periodontal treatment is it doesn't work. The dental industry knows this. We basically scrape the plaque off the teeth and hope for the best. But it's an immune response from the body. And the problem is we haven't understood the core reason why the body is responding like that. And it's from the gut. And so...
what kind of advice do you give patients then who are coming in and say, okay, I get it, I should change my nutrition? Well, what should they change their nutrition to then?
So the first thing I feel they need to look at are their vitamin D levels. And so in my book, we go right through the core problems that cause oral disease, and the fat-soluble vitamins are key for dental health. And so this kind of speaks back to Weston A. Price's work. But for periodontal disease, we know that there is a connection between low vitamin D and severity of disease, but also risk as well. And so I really find that, as soon as we see bleeding gums and gingivitis, that may be the first signs of gut imbalance. And so I think we have an opportunity to really kind of identify these autoimmune risk factors before they go down the road to disease.
So you check vitamin D, you push the vitamin D. I imagine you're also into vitamin K, vitamin A as well?
Absolutely. So vitamin K2. So a big misunderstanding there has been that, vitamin K2 is crucial for gum health. In the mouth, the saliva, we have these proteins, so matrix GLA protein and osteocalcin, that repair the gum tissues. So we need to have vitamin K2 to activate those proteins. So metoquinone 4 and metoquinone 7, both of those nutrients need to be in the body, and most people don't know about them. So if you don't think about them, you're not getting them. And so this is a model of eating that we've lost.
And from your point of view, what foods would be rich in K2s?
So I direct my patients to organ meats. Yes, you've got to have some organ meats. A slice of organically raised beef liver, or I know people feel a bit queasy when they get it, but you have to reintroduce ourselves back to traditional foods. Grass-raised eggs, butter, ghee. We can. Yeah. These are the foods that we have subsided on for thousands of years because we knew they were rich in these nutrients. So your protocol is right alongside. I often put patients on it because I know that they're going to go down this road of healing. We have to take them down there, and their gums won't heal if we don't heal their gut.
Yes, their gums will not heal if we don't get that K2 up. And if they don't, when people come in not doing well, I spend a lot of time talking about low vitamin A, low vitamin K, they need grass-fed liver, and then we talk about how to make liver and onions, and it can be quite delicious. And my kids actually love lamb liver and onions. It's quite tasty, so that's a weekly staple. And emu oil, that's something that I hear people being talked about here. Now you're an Australian young man, so tell me about emu oil. Is that something you're very fond of?
Yeah, so emu oil, they say, so there was a very a treasured tradition with Indigenous Australians where they would take the aged back fat from and extract the oil from emus, and so they've showed that this could be potentially the highest source of metoquinone 4 on the planet, and so it's a very rich, because we only get metoquinone 4 from animal products, and so not the metoquinone 7 is bacterially sourced. So emu oil is potentially a great source, and even topically in the mouth. So K2 topically in the mouth for sensitive teeth, to heal gum inflammation. I've seen good results in people having but my main message is to eat. You need to eat these foods.
Yes. No. Foie gras from emus, I bet, would be really good for us.
Absolutely.
So this is really very exciting stuff. To everyone who's watching this, I'd also like to point out that this vitamin K2, MK4, is very concentrated in the brain, and there's more and more research coming out that this helps stimulate brain stem cells, stimulates oligodendrocytes, the repair of myelin. If you're having challenges with neurodegeneration, neuroinflammation, so Parkinson's, Alzheimer's, MS, K2, MK4 is fabulously good for your brain, and apparently also fabulously good for your teeth. Now, do you have any comments about the crooked teeth and the orthodontia needs that appear to be so epidemic?
Yeah, so everything you just talked about, so the impact of metoquinone 4 on the brain. So we know that these fat-soluble vitamins have affect a vast amount of different systems in the body. Now, at a base level, they manage the bones, so how our bones mineralize, but also how our teeth mineralize. So menaquinone 4 is required for us to activate those proteins that both distribute calcium into the bones and teeth. And so one thing I really, kind of drive home is that it also balances hormones. So menaquinone 4 is known to manage testosterone levels in the body, which we relate to jaw growth. So in kids, we have to get jaws growing. The reason why we have crooked teeth in kids today is because our jaws don't grow. Wisdom teeth impactions is the same problem. So a child that needs braces at 10 to 12, that's the same growth issue as a young adolescent that has to have their wisdom teeth out. And there's 10 million in America. And I don't see children who grow jaws that fit 32 teeth now. And it's because we don't mineralize and distribute calcium in our bodies.
Does it have anything to do with chewing? When we're eating tough food that requires a lot of chewing, the lack of breast milk, breastfeeding, what's the impact there?
Yep. So connected to that, so dental nutrition shows how the nutrients that grow the jaws. One of those nutrients are physical feedback. So we now know breastfeeding, when a child pushes the nipple up to the palate, that it's actually expanding out the maxilla through forces. And so because the palate is soft like wax in those formative months. And so without those messages, the palate is skinny, narrow, and high. And if you look into a child's mouth today, you'll always, or nearly always, see a V-shaped palate instead of this nice, wide, U-shaped, flat palate. And that's because we haven't developed the right posture. We haven't breathed through the nose. So we have to get patients breathing through the nose. And this is all part of a model. We now have an interceptive orthodontic model now where we can grow a child's jaw by fixing their function. And I'm saying we need to also fix their nutrition as well, because if the bones don't have the nutrients and the messages to mineralize, then we're fighting a losing battle.
Now, one of the things that I had to come across in my research is that inadequate intakes of omega-3 also led to inadequate growth of the maxilla and the mandible, inadequate development of prefrontal cortex. You didn't have enough room in the brain as well. And so I've been talking for years that it's our nutrition and inadequate K2 and inadequate chewing, inadequate omega-3s that lead to small jaws, crooked teeth, small prefrontal cortex, more adolescent acting out. And if we could address those things, we'd save families thousands and thousands of dollars from the orthodontia and thousands of hours of heartache as their kids go through adolescence.
Oh, that message is so important, because one big problem we're seeing with kids now is when their jaws don't grow, they don't breathe right. And so we now have a big subset of kids that have they're being diagnosed for sleep apnea. And so an apnea is defined as a pause in breathing for 20 seconds. And if you count to 20 seconds and think of your child sleeping and not breathing, that is alarming. And so we now have craniofacial structures that don't support our airway. So you're exactly right there. Our nutrition has not supported that craniofacial growth. That has stopped us from managing our airways. And so our brain is in a constant state of oxygen deprivation.
So tooth decay is not about sugar?
So sugar is a factor in tooth decay, but it's a superficial factor. And so all the things we've just talked about are the underlying messages. Now, our teeth have an inner immune system. And so it's part of the osteoimmune system, where the stem cells out of our bone marrow are directed by the fat soluble vitamins, A, D, and K2. And so they're directed either to be bone building cells, teeth making cells, or immune cells. And so what happens is that we don't have those messages. We actually don't switch on those odontoblasts, they're called, inside the teeth, and they can't emit an immune reaction. Now, we've known that teeth have an inner ability to repair, to lay down reparative dentin. And so that's like an immune response when you have demineralization. So if we feed ourselves those nutrients, and that's why for thousands of years, people didn't have tooth decay. And that's why if you look back into traditional societies, they had messy plaque covered teeth, but they didn't have decay. And no biological system on the planet has decay until we eat the civilized, nutrient devoid diet.